Okay, time for our final discussion of this evening. Building future-ready smart hospitals, integrating technology with strategic vision. Going ahead, I'd like to welcome the session chair, that's Dr. Rajiv Chhibber, Vice President, Sahajanand Medical Technologies, along with our distinguished speakers. We have Aakash Shah, Director India, eClinicalWorks India. We have Neelesh Shinde, Group Chief Technical Officer and Head of Projects, Jupiter Hospital. Viloo Williams, Group Chief Information Officer, Grant Medical Foundation, Ruby Hall Clinic. Next, we have Girish, Koppar, General Manager IT, Wockhardt Hospital. A huge round of applause for our panelists, everyone.
Very good evening, everyone. Thanks for the panel being here, and thank you, everyone, for staying back. We know it's a great evening today, and what we learned from the first panel and after that, the subsequent technologies that were showcased and the kind of deliberations and discussions that we had were really invigorating, and which actually led me to think that the session that we have is called Building Future-Ready Smart Hospitals, Integrating Technology with Strategic Vision. And I thought, while everyone in panel 1 did discuss what, future-ready was and what is the need for having a smart healthcare system within the country, but I thought let's try to break that smart word, and with that then I will hand over the mics to the other panelists. So, when we looked at everything that was presented today and then the kind of vision that maybe the country has towards smart cities and smart hospitals, there is one thing that one needs to understand: what are we talking about when we talk about smart, basically. So with that, I would say would be something very specific, because technologies need to be specifically targeted towards something that can improve lives. Then with an M, it needs to be measurable. Whatever they are doing or whatever you are doing as a physician, as a hospital, or as a healthcare provider, it needs to be measurable. Then you're looking at something which is attainable. Your measurement needs to be attained. So that's something which needs to be really, nuanced when you look at the smartness of it. And then, relevance. Obviously, with changing times, relevance needs to be more and more curated and precise. And then the T, which we finally looked at, was technology savvy. Earlier, we used to say time bound, but now we need to look at technology savvy stuff. And with this, I thought, let's not make it smart, let's make it more smarter, because with the panel of such an esteemed panel that we have who've already delved into so much of technologies, we need to have efficiency being the yardstick of it, and then the R that comes last is the research orientation, because anything which we do in isolation is not going to really take it to become the next smarter things. So with this, let's start with the panel, and let's do ladies first. In this case, I'll just go to Viloo Williams. You come from a hospital setup typically that would look at dovetailing today's smart culture into how technology can actually become future ready for not only the inmates in your hospital, but also the patient centricity that needs to be looked at. So when you talk about integrating technology, when you look at how the tech smart connotation can be dovetailed, 2 things or 3 things that you really want could be your marquee, antiques that you've actually had in the hospital.
Good evening, and thank you to Healthcare Idiots for inviting me today. The smart word, the smart hospitals, has always been very close to my heart. Coming from a technology background, we are always in a healthcare environment, in a hospital environment. I've always kept a focus on patient centricity. So when we are talking about patient centricity, what kind of experiences we can provide to the patient has to be the core of everything we do in terms of technology. Therefore, when we are talking about implementing anything, we are talking about adopting any kind of technology, we first see what is going to be the impact of it on the patient, not only on the patient, but also on the caregivers, because still it does not support and help the caregivers. It's not going to reflect directly on the patient experience. So generally, when we talk about smart hospitals using technology, at times blindly go and try to adopt a lot of software, a lot of applications. Now there is a lot of AI in the market, so we think of AI all the time. But when we are actually, as a CIO, when I look at what we can bring to the table in the form of technology, the first thing is, what is the use case that we are going to drive in terms of patient experience? If it does not impact the patient, it's better not to have the technology. So the smartness to the hospital comes when, yes, we have the data available to us, we have the processes in place, we have the excellence in service, and if the software or the applications or any kind of technology that we adopt does not impact any of these, then it doesn't make sense to go for that technology or implement it. So that is how I have been taking things at Ruby Hall. We are a legacy hospital. So we are like a 60-year-old hospital today, more than 60 years. And of course, we have got newer group hospitals also in Pune. So when we look at enhancing things, we want to first keep a focus of how are we doing with our legacy systems and whether it is really helpful in today's culture and today's environment. And we start from that stage. We started from that stage, and we went on to replace the legacy systems if it had an impact on the patient. Similarly, not just because AI is in the market or everybody talks about AI, does that really bring in value to the patient when we are bringing applications enabled by AI? These things we looked at. We started from the ground up again because legacy systems work very differently or legacy hospitals work very differently from new hospitals. So when we are looking at how to proceed from there, we have to understand the difference between the two. There are a lot of my colleagues over here on this panel also, maybe working with legacy hospitals and in the audience. So when we are looking at changing the technology front in any hospital, we try to first bring out what are those use cases that need to be addressed first and how the newer technologies will help that.
Yeah, I think it's very important today that when we are moving to not only create smarter infrastructure or integrating advanced technologies, the patient centricity that you just mentioned, that they should be able to also have that kind of smartness to understand all of this is very important, which takes me actually to Aakash and Sunoh. Everyone heard all of this, and you created like not only a patient and a doctor's conversation, but also the prescriptions around it. I mean, it was a fabulous AI-based system that actually has been generated. So, how will it actually impact the patient-doctor interaction in the long run? Because maybe that app is only with the system or with the hospital. Will that be able to get a patient's attention? Will the patient be able to actually interact with the doctor after this, or it's just like the 7 days gone, the recording's gone, but then the hospital still keeps that repository and the patient keeps on requesting for it? So that's something that was not clear. And the other thing that I want you to actually dovetail in this is we've got a lot of IT rules and regulations and compliances, and something which is very important for any hospital setup which is here is patient data centricity, or the privacy that we really talk about. And that's become, after the Pegasus, it's become the really big thing that every hospital has actually need to mandate on. So something on that security aspect also. So just diving two questions into it, but maybe you could respond accordingly.
Sure. Well, Sunoh as an idea was with us since the last 10 years. We were already doing, we call it as scribe, where you put your thoughts as a doctor or a provider. It would create those thoughts or those keywords into structured format. And then came AI. We started working on this technology. It took more than 4 or 5 years for us. Created our own LLMs and used Microsoft Stack AI. And then we came up with this particular product, which we thought is a true conversational product, interactive between a patient and a provider. We kept HIPAA laws in mind. At the same time, we've always made sure that anything that has to be done with the law of the country has to be looked into first. The patient data cannot leave India. It cannot, when we say that we start using Microsoft Azure, which is a tier 5, one of the safest data centers that we have, it gives you the disaster recovery as an option. These are the things that we have done to make sure that the data stays secured. Again, data privacy, which has to be, it's something that should be only be as a right to the patient and to that hospital. We create private clouds on the Azure data center, making sure that a particular doctor or a particular organization and a hospital has access to their data, and there's, that data doesn't go anywhere else.
But then how different is it through traditional methods? That's what they're used to do it otherwise. But the only difference is maybe it's leak proof. Maybe that's what I could say.
Correct. It is leak proof. At the same time, there's a lot of other security measures, because now the data is actually traveling over the web. The traditional way of storing the data was always having client server or a locally hosted environment at the hospitals, which is what many hospitals have been doing. We see a trend where a hospital would go live with our product, and eventually in less than 2 years, they will move to cloud during the end of life of the current servers and the entire network that they have. So yes, it's the same, but there's many more added security layers when you say you are working on a cloud. Now, you can be out anywhere in the world, and you still have access to the data at your fingertips.
Wow, so
and you're not worried about data getting lost. You're not worried about any theft of the data.
No, I think something very pertinent in terms of your data security that we need to really talk about. So let me just quickly go to the next panel member. I'll go to Neelesh. So Neelesh, technically, this is just kind of a project. I mean, every sustainability aspect which can actually make a hospital more smarter is something dovetailed as a project. And I know at Jupiter you've been able to really and the hospital has actually led a lot of projects in terms of sustainability, in terms of your AI, in terms of the smartness that really needs to be looked at. Can you actually narrate how sustainable green buildings or sustainable designs can actually make an impact, and especially when it comes to a closed door environment, having the purification of maybe air quality, etc.?
Okay, so first of all, I would like to thank Healthcare Radius for giving this opportunity. Now I'm going to tell you some story, because when we say developing some smart hospital, it cannot happen in one day. I'm talking about 2004 because I'm the founder member of Jupiter, and I saw that when we were planning for Jupiter Hospital Thane, that time this smart hospital, sustainability, word were not at all existing only. We were not aware about all these things. Okay, when we built the hospital, we took care of all the equipments, which are the best technology available at time. And we also took care of patient relative, because what we are talking about now, green hospital, that concept is there in our hospital from day one. You will say there are a lot of glazing is there, like open areas are there, greenfield projects are there. But then we realized that at the end of 2 years, that our energy bill is going up to 70 to 80 lakhs per month. Then we understood, there's something has gone wrong. That is, we are not taken care of that issue. So why it has gone wrong? So we thought that the next time, whenever we'll do any planning of any hospital, we'll make sure that will become like a energy efficient hospital. Okay, and this is what a story which has begun. And then 2014 we started our Pune hospital. Now I'm going to tell you what small thing what we have done or whatever we have implemented there, and because of that hospital has got the Ministry of Power the Best Energy Efficient Hospital Award. So why this has happened? By doing small changes, what we have done, and that is, I consider small technology. First thing is that, which I personally believe that whenever we start any greenfield projects, there are lot many stakeholders are there, right from the owners, then there are architects are there, interior team is there, MEP consultants are there. What happens that everyone is having their way of thinking, okay? Everyone's putting everything on 2D drawings. You can say AutoCAD drawing. But what is important is that building information modeling, okay, BIM technology. It's a simple technology which is available there in market. Okay, we need to implement that. The reason is that it will not only give that the collaboration between all the stakeholders, but at same time, till the life cycle cost of that building, it will give the physical and functional characteristics of that building. What happens if you know that when we design everything, the PMC is involved in all the projects. But do you know that how many projects are having maintenance manager working there during that entire project? He has never been there. Most of the places happens. So when it comes to them, when the inauguration happens, everyone is more happy, but then PMC hand over to the maintenance manager or maybe maintenance engineer. They are not aware about the building. They are not aware what was thought process to build this building. So they are not aware. But with this BIM, definitely you will able to get a lot of information which will remain with you for lifelong. So this is like BIM. There is a Revit is there. It's a tool which we normally use. But it has to be used because that is very important, and this is going to make huge impact for maybe building life is for 50 years, 60 years, but that is going to be there with us for lifelong. Second thing, what is important is that when we do chiller, this finalization, a lot of times what happens in hospital, there is a lot of dynamic load is there, okay? It is not like any other data care center or hospitality building where it is like constant load throughout. It is not like so. If you see that, if you check in your hospital also, anywhere where you are working, the working maybe morning 7 to maybe 8 p.m., the load will be maybe around 500 CR or 600 TR. It will go down to 270 TR in night, okay? Definitely. But if you do proper chiller selection, and that is possible, there is a technology. It is software driven. You need to find out that, and if you select the right chiller, it is going to make huge saving, okay? Now third thing, which is important, whenever we are having any building, okay, we are having terrace. And with my own experience, I am telling, we were not aware about this. First project I did, under roof insulation, okay? And I realized that if there is some slab of 160 mm, 150 mm, that is 6 inches, and if you do under slab insulation, the temperature or maybe the energy which is going to be there on top of that slab and which will enter into building, there is a huge, if it is 42 degree, currently now if you say, most times the temperature around 42 degree. But when it comes under deck insulation, it will be similarly 2 or 3 degree difference. But if you do good waterproofing, and over deck thermal insulation, it is going to go down by around 10 degree. See that. We are talking about just difference of whether we can reduce by 1 or 2 degree. Straight away we can reduce by 10 degree just by doing this thermal insulation. Only proper insulation, there is digital software is there. We need to use it. Now second thing is that moving ahead, if you see the medical equipments, okay, medical equipments, all the vendor across the world will say that it has to run on 22 plus minus 2 degree. And what happens in this, because I work for Siemens, I work for G, because I'm a medical engineer. So my own experience, I work in a CT and MR. If you see the technical data sheet of all this company, they will say that ideal temperature can go up to 26 degree also. So what I'm suggesting is that by using BMS system, if we can able to manage during the operational hour, the temperature of 20 degree or 19 degree, whatever we want, with the humidity, but at the same time, with the BMS, if we can able to control that and can go up to 24 degrees in non-operational hour, it is going to make huge saving. Now, we are also talking about smart hospital, energy efficient. So that is, one more thing is important is indoor air quality. That is very, very important because we are talking about hand washing, then we are having antibacterial or antifungal, carpets are there, paints are there. But what is important that most of the projects, if you see that, whenever we take a handover, the duct cleaning has never been done. That is very important. Because whatever it comes from there, it is always during the construction period, there are a lot of debris is there, and which no one checks that. So that is very important, indoor air quality. This has to be there. Then we should have a proper BMS systems so that all this filter, air filter, whatever is there, sitting at one location, anyone can able to see that whether it is choke or it is working fine. Because that is going to give a good indoor air quality also. So these are the things I personally feel if we do it, definitely it will become an energy efficient hospital. and sustainable and smart hospital also.
No, thank you. I think great inputs both from Ruby Hall as well as Jupiter. And actually, if you look at it, they've really championed the entire technology circumference, because change is something which is not going to overnight happen, and you'll be able to actually invest so much into making this entire change, and then to tech savvy change, it becomes more precarious. So last, let me just come over to Girish. I mean, you just saw how we've got an integrated technology. Then we looked at how these traditional hospitals over the last so many decades have actually been able to cope with technology as well as the smartness. From an IT perspective, few things that possibly you feel that need to be the harbingers of change, that really need to strike a hospital when they move into this smartness, or when they move into this new age era of technology?
See, in the previous session, we saw all the people talking about technology, how hospitals can be smarter. The entire focus was on IT and technology, because if you see, 10 years back, IT was not very this thing. It was just now it's become an enabler, right? Because now everybody is looking at IT to give a solution for everything. So the smartness now is, because you see there are a lot of hospitals which are new, but what about the hospitals that are old? How do you make them smart? That is the biggest challenge for any IT CIO of a hospital. So we at Wockhardt have a combination of new and old hospitals, and as Viloo was saying, there is something called legacy application. So the biggest challenge now, what an IT person has, how to bring the change management. That is the toughest thing for an IT professional, because there are a lot of expectation and everybody is looking at you. How do you make existing hospitals smarter? I'm talking in terms of technology only, right? Because Neelesh spoke about the other aspects. So I'll just speak about how technology will make smarter. Yes. So if you see the stakeholders, you have doctors, you have patients, you have your external vendors, everybody. So when you say you have to make it smart, you have to make it smart for the entire ecosystem. You can't just make it for a patient, or you can't make it for an internal stakeholder. It has to be for everybody. So everybody should feel they are working smartly. So the basic example, what I would like to do is, how it has eased the things for everybody who are working traditionally. So we can take some examples where there's some mundane jobs which can be optimized. So a very basic example, when a patient walks in, there is a patient registration, where there's a lot of things that needs to be captured, and the person sitting there, it's a very mundane job for him to enter each and every field, because he doesn't understand the importance of putting in the PIN code, all the details. So if you just integrate with the Aadhaar, you have made that person smart. So this is a very basic example of change management, where you, in the existing system, you integrate your registration process with an Aadhaar integration. So all the data which is there in the Aadhaar, and it is all clean data. Because the data being entered by a person at the registration may not be clean. He may skip some fields,
Abha could also be the next step, because then you'll have an entire history also.
So the entire theme of making a smart is make the person who's entering the data smart. Yeah. So give him that tools. We saw Sunoh. So also we saw this Marshal mats. So you have to make it for everybody, the clean data, make everybody smarter. They should feel the difference, So if the person entering the data is Aadhaar integrated, we can have excellent dashboards, right, which were not able to do. We can have a lot of dashboards which are for the marketing, where they can have what you call region-wise, gender-wise, everything. All those reports which are not possible, that would be possible. So when you say smart, you have to do everything smart. So the entire focus should be on technology, how you ease the work of the patients, the nurses, and everybody. So only then it will be a smart hospital.
No, thank you very much. I think from a hospital's perspective, you all touched upon something which, talked about how resilient the hospital have been towards the change, how tech savvy they've been. But let me just come back to Aakash. Aakash, when these guys, which is from the hospital perspective, and you're being from the service side, technically, if you look at it, we all talk about how to design a smart hospital of the future when the future itself is unpredictable. How can how can technology from your perspective really be that, predictable analyst that can actually help hospitals like them to really, take over an onslaught like COVID kind of like struck? It's like, unfortunately, I'm giving a very bad example, like the Met department trying to tell us when the rain's going to come and it doesn't come. So we don't want to fall in those kind of traps. So that's where technology really plays a big role. So your thoughts on predictability and technology, and how this is going to take forward the new health age, new age era in India and also globally, because you worked outside here.
Great. Well, Girish just said a very valid point. Technology has become an enabler. It was not getting the due importance before. Now everything is tech. I'll give a classic story of how we changed, how we helped the New York City Department of Health to predict outbreaks. And we ended up deploying our software to more than 5,000 doctors across the city. And after putting in the data, after the doctors using the software and the application, for more than 6 months, the DOH, which is the Department of Health, found out that there are certain pockets in New York City which are obese. So there was a predictive analysis done on that data, and they found out that those particular pockets have many or too many licenses given out to fast food joints. This is just an example. And then they actually moved licensing of those places, of those restaurants, and they scattered them out to make sure that there are more healthier options given out to the population, and not just the fast food joint. Now, this is just one of the examples. But there's so much you can do when you have data. There's so much predictive analysis you can do for outbreaks of diseases, like the Zika virus. There's so much. In the end, I think it all boils down to making sure that you have technology which is forward-facing. You are using AI, you are using predictive analysis, and it is helping the organization in some or other way. It also helps in building the revenue for the hospital. One more quick example. Technology can actually even run campaigns in certain seasons where you can shoot out messages to certain population health, where their blood pressures, flu season, depending on the symptoms, depending on what data you've captured for each of your patient population in the hospital. And you run the campaigns, and you basically keep reminding your patients to come and see your doctor. A human being has to be reminded that this is the reason we want you to come back and see this doctor at the hospital or the clinic. All these things can only be done if you have the right technology. So yes, it is an enabler, and importantly, it is much more futuristic now.
Yeah. No, I think what you said is very important, because through technology, if we can have a proper disease dynamic profiling being done, that's where, hospitals can get really smarter. Let me go back to all the 3 hospitals right now, starting with Viloo. A common question to all 3 of you, maybe, anyone could start answering. We've heard so much, and, you've really championed it over the years and decades to really come up with off-edge technology. How would you think that technology can still be patient-centric, can be resilient, and also evolve towards the current medical needs, whether it is in-house medical needs? We were just offline discussing about how medtech equipment is coming, and you're trying to, you're grappling with the quality issues in that, or, ultimately the external, tech needs that really can be done. So this is kind of like a question to all 3 of you. And so as per your convenience, maybe keep on responding. But yeah, we'll start with Viloo first.
Let me start with an example. Earlier when I said that we should look at use cases as a rule to decide how the technology is going to help. Now, when he said we should make it patient-centric, when a patient is coming to the hospital, he is definitely coming for treatments. And we may have the best of diagnostic equipment, we may have the best of OTs, we may have the best of treatments in terms of medical facilities, services. But if that patient still has to go through and wait for an appointment for 1 hour, for a test which would actually take 15 minutes, then that is not patient centricity. The patient is not going to be happy that I got a very good treatment after waiting for 1 hour. So when we are talking about a use case, for example, in admissions, when patients are getting admitted to the hospital, all of us know that we have beds, we have occupancy, we monitor the occupancy, we do everything to give the patient a bed when he comes into the hospital, he or she comes into the hospital. But when your hospital is going full, for example, and if the hospital is having 90% occupancy, let's say, we definitely make a patient wait and say that, okay, beds are not available, it'll take 1 hour to get you admitted and put you into a bed. Technology, on the other hand, could easily solve this use case by coming up, and I'm also addressing the previous question which you had put to Aakash, that how do you decide which futuristic technology we should adopt? So when we are talking about a bed occupancy as a simple example, where we can save a lot of time for the patient, we need to understand, do we really know sitting at one point in time, do we know how much time are we going to make the patient wait to get a bed if your hospital is going full? How are you going to really make the whole bed occupancy system be streamlined in such a way that the patient is informed well in advance when the bed is going to be available? The patient is, how we are as a hospital management are going to decide that if we are going full, how do we contain the occupancy, the bed availability in such a way that we either rotate or we bring in a system to tell us that, okay, by doing 1, 2, 3, 4 steps, your bed will be free by this time. And then inform the patient accordingly, communicate to the patient, and get the patient only to the hospital at that time. There is a complete process or an operational system that can help the patient a lot if that is streamlined using technology. And we can build the software or the applications in such a way that these things are definitely enabled. Here again comes the predictive analytics on why we are not having the beds available when we want them available. Whether it is the length of stay control, whether it is overstay control, whether it is if the data is not at your fingertips, you can't take decisions. And technology has to be available to drive that data in such a way that the data is driving your decision making.
Yeah. Girish, data driving decision making.
So I'll give technology is everything to do with the enhancement of the patient experience. So there's something called NPS or patient feedback, where we need to listen to the patient to understand what does he expect, what does he feel. So the typical examples where we can enhance a patient experience is how do we minimize the time for discharge, which is the biggest pain area for hospital. Can we automate some process? So there are a lot of technology being used, RPA is being used for a long time. How do we reduce the time of this thing? Second option is like we heard Dr. Neeraj that he actually 2-3 POs he just so there's a lot of expectation from the patient, from the management, from the patient also. What we are trying to do is we are trying to engage the patient every time. Whenever a patient is taking an appointment, we try to send him videos where know your doctor. We try to send so that anxiety of the patient before meeting the doctor is gone, and also that really helps, So that is what we are doing.
No, absolutely.
And just one last point. Does the patient really needs to come to the hospital? So, yes, can it be done on a call? And there are a lot of patients, surgical patients who are discharged who need some care. So we also call up those patients post-surgical discharge. Do they need any help? Can we do a home visit? So these are small things, but it increases and enhances the patient experience.
No, Neelesh, you just heard both of them, and they largely talked about how patient-centric, design elements can be looked into, and what could be the, integration of advanced technologies. But you focused largely on sustainability and the life cycle itself. So, last words from your side.
As I mentioned earlier, that couple of things which is very, very important is that indoor air quality. Okay, now if you see that when our patient is there in ward, most of the time is like fan coil units are there. Okay, but fan coil units, we see the coils there, but there is a fresh air is supplied to that fan coil units. But no one checks whether fresh air which are being supplied to them, whether filters are okay or not. If those filters are not okay, this is not going to be visible, but that indoor air quality is going to face a lot of issue for the patient. Now, how we can see that? Now, if you say physically someone go and see that, the management will never come to know, because maintenance wala to bolega, maine to check kiya. Whatever he will say, he will do the checkmate, but for him it is okay. But then there is a system available. There are some digital system sensors are available, which can able to tell whether those filters are working or not. That is the first thing. Second thing is that the way we mentioned about the CSID. There should not be any compromise whenever we are using CSID equipments, whenever we are procuring CSID equipment. The reason is that whenever we always believe that when there is a bedside procedure happens, that time we open those, the tray which are there, which has been passed through CSID equipment, has to be very clear and very, I can say disinfected. Then only it is like for patient when we are operating, and when we are using those equipments, instruments, that should be very clearly that it is properly disinfected. That is the second thing. Third thing is that when we say that patient-centric, I always believe that koi bhi hospital mein, it should not happen that fire. Okay? We always take fire so lightly. Chalta hai approach. But when we design hospital, if we design properly, that every small thing, if there is some problem there, if you are having proper sensor, if you are having proper smoke detector, it has to activate fast. Because this is something we can do maximum horizontal evacuation. Baki sab mock drill to only for audit purpose. Reality mein kuch nahi hone wala hai. That is the reality. So these are the things I can say patient-centric, because everything else now, there are some remotes are available. When patient is there in ICU, they can't do anything. Only patient relative has to be more comfortable in that. But when patient is there in ward, okay, there are a lot of things now, gadgets are available where he can able to do everything. He can, now I've seen recently one gadget where there's a remote there where 8 functions are there, including AC nahi chal raha hai. Or there is some problem is there, so issue will go to that person. Now, still in India, now can we give that smartphone to class 3, class 4 guys? That is also question mark. Otherwise, they will start using that something else only, and the main information, we will lose it. So these are still questions are there, or still we have to move ahead, but at the same time, patient-centric. Other than all these softwares, the importance that the safety of that patient who is going to come, that is an important part of any hospital management, because that is very, very important. We cannot do anything there in last moment.
No, thank you, everyone. Thank you for your, great insights on how technology can actually be a new harbinger towards not only smart cities, smart hospitals, but also smart healthcare systems. So with this, thank you everyone for the patient listening. I don't know, we're between now the food and going home. So any questions, or everyone is here. So offline, I would suggest you just reach out to them if you have any questions to them. Thank you very much.
Thank you for your invaluable insights. Can we have a huge round of applause for all of them? I request you to please stay on the stage. Now I would request Jagdish Biswas, Assistant General Manager, Merino Laminates, to please come here for the felicitation. Can we have a huge round of applause for him, everyone? Let's hear it for him as well.